My name is Michael Cain. I serve as Vice President for Health Sciences and Dean of the Jacobs School of Medicine and Biomedical Sciences at the University at Buffalo in Buffalo, New York. My area of interest has been in sudden cardiac death and identifying those patients who are at high risk for sudden death so that appropriate pharmacologic or non-pharmacologic therapies could in fact be implemented for the purpose of decreasing their chances of dying suddenly. And I've been involved in this field now for about 35 years, and during that period of time there has been a lot of progress in potential risk markers. And the 35 years or 40 years of research in this area have identified that each of these new markers has value in its negative predictive accuracy, but suffers because the positive predictive accuracy has not allowed a really accurate prescription of these interventions to prevent sudden death. So the challenges and opportunities for the future are the following. One is to either develop new tests that have a better positive predictive accuracy, and there's a few that have been developed and are now being tested, one of which has been at the University at Buffalo, which is looking at the volume of denervated myocardium assessed with positron emission tomography. A second area of progress has been the realization that of the many risk factors that have been identified individually, that many of them are actually additive and synergistic. And so rather than making decisions based on one risk factor, use several, and the more abnormal risk factors that a patient has, actually the more likely they are to be at risk for sudden death, improving the accuracy of prescribing therapies to prevent sudden death in them going forward. And the third area where there needs to be new knowledge is that most of the focus for identifying people at sudden death has been those patients who have pretty severe and incapacitating heart disease that have very, very poor ejection fractions. And although this particular group is at highest risk, there's actually many more patients who are at risk for sudden death who have more preserved left ventricular function. So there are new ways using some very basic principles from the electrocardiogram that are now being shown, when used in combination, become pretty powerful predictors of individuals who have less apparent heart disease, but nonetheless are still at increased risk for sudden death. And so this is good news for both the public health and this particular area of research.